Hi, I'm Dr. Jen Peña, and I'm here to give you the scoop on all the headlines in sexual and reproductive health that are dominating your group chat. This is Doom Scroll.
Hi, how are you doing?
Hey, Annie, how are you? It's great to see you.
It's so nice to see you. I'm super excited. I heard that there's potentially a new male birth control that's making its way to the market. How has this come about?
The Washington Post called it the Viagra of birth control, which I thought was really funny. What it does, it controls this enzyme that helps sperm move. So by prohibiting the sperm from moving around, it helps with preventing pregnancy.
An article from Cornell said that the effects persist in the female reproductive tract after mating. Would this have any effect on women in the long run?
When they did the study, what they noticed is the effect of the medication kicks in 30 minutes, but it lasts 2 hours. And so when we think about, well, how could this affect the female? Well, technically, after those 2 hours, the woman could potentially get pregnant, right? Because we know that the sperm can last in the female reproductive tract up to 5 days. So it wouldn't have any of those side effects that we think about with hormonal contraception, for example. And something super important to remember is that it also doesn't have any protection against STIs.
From a legal standpoint, do you think this is something that could be realistically put in the market?
It would have to go through the same pathway that all drugs and medicines have to go through with the FDA. Normally, male contraceptives are tested, monogamous relationships where you watch to see if the female gets pregnant. For female birth control, normally they weigh the risk versus benefit compared to birthing a baby, right? Which is actually a risky thing. Having a baby has its risks. And so when they think, okay, well, what's the risk of, birth control in women? They seem very small compared to having a baby. But with men aren't going to get pregnant, right? So even the slightest bit of side effects or risk in the male contraceptive might be considered too risky.
How would it be used? Is it a pill or is it through a patch or?
I do believe it is an oral pill. Don't take my word for it. I actually don't know 100%. So I suspect it would be given an indication to take right before sexual intercourse or shortly before, kind of like Viagra, right? And then given a duration of that 2 hour window.
And would women have to take emergency contraception after unprotected sex, even if their partner is on male birth control?
I would say yes, again, because like we discussed, sperm can live up to 5 days in the female reproductive tract. So this birth control method is not killing the sperm, it's just making them lazy for 2 hours. Once that 2 hours is done, they'll get their motility back.
Do you think that there'll be an age limit?
I would say probably will end up similarly to female birth control, where in most states, teenagers can get birth control without parents' consent. So I suspect it'll probably be something similar to female birth control.
Thank you so much for all this information. I was so nice talking to you. I'll see you soon.
Thank you, Annie. It was great chatting. See you soon.